Order. Question number 3, Sarah Dowie.
Well, thank you, Mr. Speaker. My question is to...
Order. I gave warnings earlier. Chris Hipkins hasn't managed to hear it, so I now direct it to him specifically. If he continues to interrupt at that sort of level, then I'll be asking him to leave early. Sarah Dowie, question number 3.
Thank you, Mr. Speaker. My question is to the Minister of Health. What work is being undertaken to ensure that from 1 July 2017, 55,000 care and support workers will begin to be paid their share of the $2 billion pay equity settlement announced earlier this year?
Mr. Speaker.
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, since the settlement was announced in April, I've been receiving regular updates on the implementation. I'm assured by the officials that implementation is on track. I've been advised that all providers have indicated that they are ready to pay eligible employees the increased hourly wages from the 1st of July. Funds will be transferred to 653 providers by the end of this week, and that will enable providers to have funds in their accounts to pay the 55,000 workers from next week. This is part of this year's $880 million increase in Vote Health, the largest increase in 11 years.
Supplementary question, Sarah Dowie.
Thank you, Mr. Speaker. To the Minister, can the Minister confirm how much extra employees will receive from the settlement?
Mr. Speaker.
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, this dedicated and predominantly female workforce, who are mostly on or around the minimum wage, will receive a pay rise between around 15% and 50%, depending on their experience and/or their qualifications. For the 20,000 workers currently on the minimum wage, it means they will move to at least $19 per hour, a 21% pay rise. For a full-time worker, this means they will be taking home around an extra $100 a week, which is over $5,000 per year in the hand. This will make a massive difference to some of the hardest working, most deserving, but lowest paid people in this country and their families.
Question number 4, Grant Robertson.
Well, thank you very much, Mr. Speaker.